Hi, my name is Dr. Rachel Cohen. I am the owner of Listen Here, a audiology practice in Florida that specializes in auditory processing disorders. Today I wanted to discuss with you what an auditory processing disorder is and how we can treat it, why it's so important in the classroom environment to treat auditory processing disorders so that it doesn't look and appear to be ADHD, ADD, or dyslexia. Did you know that we can hear 25 to 30 phonemes per second in our brain? And if we process those incorrectly, it will mess up the message completely with what we've heard if it's not processed properly. Auditory processing disorders is what our brain does with what our ears hear. Yesterday, I tested a child, and instead of this sentence, "Hand me a slice of pie," he heard, "Hen me a slice of 5." There was also a question about 10 chairs, and he heard Kim tear. If your child is having problems listening with background noise, gets easily distracted by lots of visuals around them, has or appears to have ADHD or ADD, is having difficulties with spelling, reading comprehension, or following directions, especially multiple step directions, or is having problems with some short-term memory, getting 3 items and bringing them back to you. These are all signs of auditory processing disorders, and you should have it taken a look at or evaluated. The sooner and earlier, the better. Although many tests are normed down to 7 years old, there are quite a bit of tests that are now normed down to 6, 5, and even now 3.5 years old. It's important that even if we're not diagnosing an auditory processing disorder, we are seeing that there are weaknesses with processing and getting started with therapy as early as possible. We know in all other areas of our whole body that early intervention is key. We want to treat auditory processing the same way. Now, what does it look like to your child's teacher if they are hearing "Hen me a slice of 5" and they're not able to process that when the teacher says, "Hand me a slice of pie"? Maybe they look distracted. Maybe they fidget a lot. Maybe they're bored and start moving. Maybe they are talking to the person next to them and getting in trouble. This starts affecting their self-esteem. Sometimes it causes them anxiety and frustration. Please reach out to an audiologist near you that knows how to treat auditory processing disorders. It can make the world of difference for your children. Thank you.